New Mexico is a very, very large and mostly rural state. People's access to healthcare really hinges on these few entities that exist across the state. I received sort of one of the first alerts that went out once folks realized that this acquisition was in the works. It was extremely concerning for us, knowing that particularly this work with the New Mexico cohort has been focused on this exact type of situation. We sort of jumped into action and talked about what can we do.
Once we became aware of this through our friends, our different cohort partners and coalition partners, immediately like we begin to think, okay, who are the communities that will be affected by this, and what is like the geographical realities and also like the service realities that exist within Otero County.
A few of us got together and wrote a letter, right, demanding transparency, alerting folks to what the law says, what the requirements say. Others were working with training individuals on how to engage in sort of civic debate and public comment and things like that. And also just making sure that people knew what their rights were.
We knew at this point there was not going to be the ability to stop the acquisition. It was from there going to be more of community leadership, harm reduction, education for those in Otero County.
We know the community members, we know who lives here, we know who's going to be affected by this. Do they know what's going on? And exactly how Charlene had mentioned, how can we make it driven? How can we make this like the whole cohort, the whole project driven by the needs of community? And like, damn, they were really, really adamant about like what we need to know and what we need to know now, right?
We all have unique strengths that lend itself to this work, and that's what really helped. As Jovanny was mentioning, being able to organize and identify, these are the communities that we need to be talking to, these are the folks that we need to hear about their opinions, their needs, their concerns. And then we have ACLU, who's talking, going through, let's do know your rights training, let's make sure that folks know what to ask, let's make sure that people understand what is happening so that they can make informed decisions for themselves and their family members. And as Bold Futures, making sure that we're sort of connecting. We're doing a little bit of the research, we're doing a little bit of the mobilizing of folks, we're doing some of the resourcing, making sure that people have access to travel and to be in Santa Fe during the legislative session.
We reached out to community leaders. We had many conversations with them, gathered what their priorities are going to be, moving towards our priorities, which included SB 15, which went forward with the help of the governor. It was the governor's priority. We knew we weren't going to get everything we wanted. We knew we were going to have an uphill battle, but just starting, and sometimes you have to do the culture shift before you could do the policy shift, just starting these conversations this past year was incredibly helpful for people to see the forest for the trees, as one would say.
I think what it has done is kind of given us like a blueprint of community involvement, how we can search for that and really activate it, because it exists already, right? It just needs to be activated, organized in a certain kind of way.
On paper, it can look like we had this really organized response, and we had a policy response, we had a community response, we eventually had a legislative response, we had a media response. But a lot of that is contingent on the years and years and years of work that we've done in community and with policymakers to build power. So we can just make phone calls.
It's been really powerful work. And again, I'm just really appreciative of the support and trust of RFDC, and also Dream Team and ACLU for just being wonderful partners.